Does, does he want? She want to? Does he want to check? She want to? She want this? She want this? She want this? Does he want to? She
Ladies and gentlemen, we are about to begin the session, so please take your seats. Officials and dignitaries, ladies and gentlemen, a perfect morning to all of you. Welcome to the regional commemoration of World Diabetes Day 2024, themed Breaking Barriers, Bridging Gaps, organized by the Ministry of Health, Government of Sri Lanka, in collaboration with the World Health Organization. This opening session is also being live streamed across the world through the WHO platform. Now, let's stand for the national anthem of Sri Lanka. Sri Lanka, Sri Lanka, To mark the beginning of this momentous event, we now perform the traditional Sri Lankan lightning of the oil lamp, signifying the cultural practice of bringing in best wishes for the event. I call upon following dignitaries for this event. Dr. P.G. Mahipala, Secretary, Ministry of Health Sri Lanka. Dr. Guy Fawns, Acting Director, Non-Communicable Diseases, World Health Organization Headquarters. Dr. Alaka Singh, World Health Organization Representative to Sri Lanka. Representing all the countries present, Dr. Kachung, Deputy Chief Program Manager, Ministry of Health, Bhutan. Dr. S.C. Vikramasinghe, Deputy Director General, Non-Communicable Diseases, Ministry of Health, Sri Lanka. Dr. Kumara Vikramasinghe, Deputy Director General, National Hospital, Sri Lanka. Dr. Samidhi Samarakon, Director, Non-Communicable Diseases and Deputy Director General, Education, Training and Research. Dr. Kumara Vansha, Director, Ministry of Health, Sri Lanka. Dr. Dhammika Jayalat, Provincial Director of Health Services, Western Province, Sri Lanka. Dr. Chandana Gajanayaka, Regional Director of Health Services, Colombo. Dr. Senaka Talagala, Regional Director of Health Services, Kandy. Dr. Nalika Gunawardana, Regional Advisor, Non-Communicable Diseases, WHO Southeast Asian Region. Dr. Stefan Bernard Shaw, Medical Officer, Non-Communicable Diseases. Mrs. NDC Ruanti, Public Health Nursing Officer, Ministry of Health, Sri Lanka. Also, I would like to cordially invite delegate representing Thailand for the traditional oil lamp lighting ceremony.
Happening over the city, Wednesday's contract news has been a much needed boost.
Now, I cordially invite Dr. P.G. Mahipala, Secretary, Ministry of Health, Sri Lanka, Dr. Guy Fons, Acting Director, Non-Communicable Diseases, World Health Organization Headquarters, Dr. Alaka Singh, World Health Organization Representative to Sri Lanka, Dr. S.C. Vikramasinghe, Deputy Director General, Non-Communicable Diseases, Ministry of Health, Sri Lanka, Dr. Samidhi Samarakon, Director, Non-Communicable Diseases, and Deputy Director General, Education, Training, and Research to the head table. To begin the proceedings, I cordially invite Dr. Champika Vikramasinghe, Deputy Director General, Non-Communicable Diseases, Ministry of Health, Sri Lanka, to deliver the welcome address.
Good morning, ladies and gentlemen. Globally, around 828 million people have diabetes. There are 2 million deaths directly attributable to diabetes every year. In the WHO Southeast Asia region, more than 246 million adults 30 years and above are estimated to have diabetes. Diabetes and its complications bring about substantial economic loss to people with diabetes and their families and to health system and national economies. Unaware of their status, and 177 million people living with diabetes are not on treatment. In April 2021, WHO launched the Global Diabetes Compact to reduce the risk of diabetes and ensure that all people diagnosed with diabetes have access to quality care and treatment that is equitable, comprehensive, and affordable. The 75th session of WHO Regional Committee for Southeast Asia endorsed the implementation of roadmap for the prevention and control of NCDs in Southeast Asia 2022 to 2030. This outlined NCD targets for 2030, including 5 global diabetes coverage targets. The resolution of 76 WHO Regional Committee, CHARTS, Accelerating Prevention and Control of Cardiovascular Diseases in the Southeast Asia region, endorses 4 milestones, including milestones to place 100 million people with diabetes and hypertension on protocol-based management by 2025 as a step to improve diabetes coverage and control in primary healthcare. The target for Sri Lanka is to place 1 million people with diabetes and hypertension on protocol-based management. It is observed that countries in the WHO Southeast Asia region are making steady progress in the provision of services for prevention and management of diabetes. But despite various efforts, countries in the region continue to face challenges with high rates of undetected, untreated, and uncontrolled diabetes. World Diabetes Day, breaking barriers, bridging gaps, serve as a reminder to all of us of the need to collectively work to overcome the growing burden of diabetes globally and in WHO Southeast Asia region. The theme emphasizes the importance of tackling the challenges faced by individuals, communities, and health systems to access diabetes prevention and management in this context, and with the aim of highlighting the importance of diabetes as a significant public health issue, while also addressing the existing challenges and opportunities in the region to improve its prevention, diagnosis, and treatment. The Ministry of Health, Government of Sri Lanka, in collaboration with WHO, conceptualized the advocacy event, Regional Commemoration of World Diabetic Day 2024, Breaking Barriers, Bridging Gaps, with the objective is to advocate the integration of global diabetes compact key asks into international health agendas across countries and frame the Colombo call of action to strengthen diabetes prevention Southeast Asia region. Ladies and gentlemen, I would like to welcome you all to this advocacy event that will be held today and tomorrow. Today there will be 4 technical sessions and a poster presentation. The posters were sent by regional countries and other organizations, and I would like to thank all the presenters. Tomorrow there will be a field visit followed by the presenting of the Colombo call to action for strengthening diabetes prevention and control in the WHO Southeast Asia region. All feedback given in the 2 days will be incorporated to this call of action. I would like to welcome Dr. P.G. Mahipala, Secretary Health, for participating in this event. And sir, we are looking forward to listening to your keynote address. Also, I would like to welcome Dr. Guy Fons, Director in CD, WHO Headquarters, WHO Sierra, and Dr. Alaka Singh, WR Sri Lanka, and the staff to this meeting. Dr. Alaka and her staff have worked Ministry in organizing this event, and I thank her for all the hard work in organizing this international event. I would like to welcome Dr. Samiti Samarapon, Director NCD, all the directors and consultants of academic colleges, MO NCDs, PHNOs, and staff of the NCD unit to this meeting. And I would like to most welcome representatives from all countries in the region and other regions. Your presence is a strength and an encouragement to us, all of us, and we very happily welcome you to this event. There are many speakers from abroad and locally, and I most gratefully welcome them. There are many participants joining online, and I would like to welcome all of you to the meeting. Finally, I end my welcome speech by wishing this meeting all the success. Thank you.
Thank you so much, Madam. Dr. Tedros Ghebreyesus, Director General, World Health Organization, has expressed his best wishes for a successful and a productive meeting. Let's listen to him in this video.
Excellencies, dear colleagues and friends, A warm welcome to everyone gathered today in Sri Lanka to commemorate World Diabetes Day. I thank Sri Lanka's Ministry of Health and the WHO country and regional offices for hosting this important event. This year's theme, Breaking Barriers, Breaking Gaps, is a timely reminder of our shared. Over the last 3 decades, the number of people living with diabetes has quadrupled, now reaching more than 800 million adults, and more than do not receive treatment. The alarming rise in diabetes is seen across the world, and the Southeast Asia region is no exception. Over the past 3 years, we have made significant progress with strong commitments by member states to strengthen prevention, diagnosis, and management of diabetes, complemented by the Global Diabetes Compact and its 5 global targets. I thank the Southeast Asia region for its leadership and its ongoing work towards achieving those targets through the Sea Hearts initiative, which has helped almost 60 million people with diabetes and hypertension to access treatment. Thank you all for your commitment to the fight against diabetes as part of our shared commitment to health for all. I thank you.
On to witness the message Saima Wazid, the WHO Regional Director for Southeast Asia, who has assured the commitment of WHO to support the countries and the partners to accelerate the prevention and control of diabetes.
Excellencies and officials from the government of Sri Lanka, officials and dignitaries from our member states, experts, partners, colleagues, and friends, good morning, and welcome to this regional commemoration of World Diabetes Day. Before any further, my thanks to the government of Sri Lanka for organizing this event and bringing much needed attention to the problem of diabetes. Our theme today, Breaking Barriers, Bridge Gaps, reminds us of the barriers, behavioral, socioeconomic, and within health systems to addressing diabetes. It calls on us to collectively act on evidence-based solutions and innovations to overcome these barriers while accelerating cost-effective interventions for diabetes prevention, diagnosis, and management. In our region, approximately 246 million people are living with diabetes, yet only half of them are aware of their condition. Worryingly, less than 1 in 3 adults is receiving treatment. Given this backdrop, I would like to acknowledge and commend the government of Sri Lanka for its efforts to bring diabetes to the forefront as a public health issue. The outcome of this event, the Colombo Call to Action, step towards diabetes prevention and management in our region. Sri Lanka has made significant progress in addressing risk factors for non-communicable diseases, such as unhealthy diets and physical inactivity. Notably, implementing new regulations to eliminate trans fat and also network of healthy lifestyle centers to expand prevention and NCD screening facilities. Countries and partners must take action to meet the Global Diabetes Compact targets by 2030. We are at a history-defining juncture, and I urge you all to use this event to decisively commit to the work ahead. I am proud that our Southeast Asia countries have committed to 4 ambitious Sea Hearts milestones by 2025, including ensuring that 100 million people with diabetes and hypertension are on protocol-based management. I am pleased to say that as of June 2024, our countries have already placed over 60 million people on such protocol-based management. However, we still have a long way to go. Our primary healthcare facilities must be equipped to meet the increasing demand for preventive and management services. This includes the use of standard treatment protocols across all facilities, availability of essential medicines, affordable and quality diagnostics, and well-trained healthcare professionals. Your deliberations, the regional office stands beside you. I stand beside you. Thank you.
We are honored by the presence of Dr. Guy Fons, the Acting Director, Non-Communicable Diseases Department, WHO Headquarters, who is with us at this event. Now, I respectfully invite Dr. Fons to address the audience.
Thank you. Good day. Good day. Honorable Secretary, Dr. Maipala, Deputy Director General of NCDs, Dr. Wickramasinghe, our WHO representative in Sri Lanka, Dr. Singh, distinguished colleagues, dear friends, member states. I begin also by expressing my sincere gratitude to the Ministry of Health of Sri Lanka and WHO regional country leadership and vision in organizing this important event. Sri Lanka has been a valued WHO member state for over 70 years, demonstrating national successes and impacting the health agenda at regional and global levels. This event is a clear example of just that. We look forward to strengthening that collaboration further as we catalyze much needed progress in addressing the crippling impact of non-communicable diseases on individuals, families, and societies. Business as usual is not an option. Today, I'm honored to stand alongside representatives from Ministry of Health, experts, partners, civil society across the Southeast Asia region, but also from the African and Western Pacific regions. I welcome you all. This year's World Diabetes Day theme, as we've heard already in keynote speeches, breaking barriers, bridging gaps, reminds us that our journey towards health for all, especially for those with diabetes, is far from complete. The painful truth is that in nearly all countries, the chronic underinvestment in health services has created a significant gap between the need for and availability of effective prevention and quality care and support for people living with or at risk of NCDs. To close this gap, health systems must be reoriented towards primary health care as a foundation for universal health coverage and health security. Just a few minutes ago, Dr. Tedros pointed to the unacceptable health inequities. Over 800 million people worldwide are currently living with diabetes. This represents a fourfold increase over the last 30 years, with the largest increase seen in low and middle-income countries. Alarmingly, more than half of people living with diabetes are not receiving treatment. This disparity places people in low and middle-income countries at higher risk of complications and death. Today, we stand at a pivotal moment to act and halt the rise of diabetes and close the gaps in diabetes diagnosis and treatment. WHO member states confirmed the political commitment and action required to address the rising burden of diabetes by adopting the historical diabetes resolution in 2021, which we have also been pointed towards in previous keynote speeches. But this political commitment was followed by the endorsement of 5 global diabetes coverage targets to be achieved by 2030. WHO, as an organization, quickly stepped up to walk the talk in its role to support member states advance diabetes prevention and management by launching the Global Diabetes Compact in 2021. We will hear more about this important initiative shortly today. I want to acknowledge CIRO's leadership through the flagship C Hearts initiative, which has already unified member states to scale up the WHO technical packages aimed at improving diabetes prevention and management. We should all be inspired by the region's vision to catalyze enhanced action and adapting the Global Diabetes Compact into regional context. Over the next 2 days, our active participation is critical to ensure that we sign off on a call to action relevant not only for that enhanced regional vision, but also influential at the global level at a critical moment for the future of billions of people living with NCDs. This call to action must inform the fourth high-level meeting of the United Nations General Assembly on NCD 25. This high-level meeting presents a significant crossroads, an opportunity to reaffirm the many unmet commitments from heads of state and government, but also a unique opportunity to set a transformative map for preventing and controlling NCDs, including diabetes, for 2030 and beyond. Each of us here must shape that vision by ensuring that innovative addressing root causes to expanding access to detection and treatment can spearhead progress on the broader NCD epidemic. I call on all of you, us, to fully engage in this meeting and commit to creating a bold, actionable, and measurable call to action. I thank you.
Thank you, sir. Meaningful engagement of individuals with lived experiences of diabetes is an important strategy to improve health outcomes of chronic diseases. At 18 years, Kiara Power, who is present virtually with us today, is India's youngest female sportscaster and a voice of diabetes. As a type 1 diabetic, she leverages her growing social media platform to educate, inform, and dispel stigma and misconceptions surrounding diabetes. In this video, we will witness a glimpse of her most recent campaign, Don't Fear Insulin.
Hey everyone, today I will talk about people living with diabetes. As someone who's lived with diabetes since the age of 2, I know that the struggles are far more complex than they seem. I'd like to share some of the few challenges that I've faced over the past few years and how these challenges have shaped my journey with diabetes. One of the toughest experiences I remember was from when I was 5 years old. I heard these parents telling their children that stay away from Kiara. She takes 4 injections a day and diabetes spreads through touch. I'm mature enough to understand that now. But back then for a 5-year-old, it wasn't easy. Another challenge was and still is taking insulin in public. So back then, I used to feel very uncomfortable because, people used to give me that stare that, as if I'm doing something wrong. But, through the years, I learned that, insulin is not something to be ashamed of. And that's why, I very proudly and, openly take my insulin in public because, insulin is my best friend. There's another moment that I want to share with you all is that when I went to a spiritual trip, I came across 3 people who mistook my CGM sensor to a bottle cap. And, I very politely, answered to them and tried to spread as much as knowledge I could. But the sad part was that people gave me that look that, oh, she's diabetic. And moments like these just remind me of how much education, knowledge, and awareness still needs to happen. That's why I would like to tell the society to stop with the judgments and misconceptions because diabetes isn't as straightforward as it looks, and your understanding and kindness can really help navigate this condition. To all the healthcare sectors out there, we really require affordable, accessible, and empathetic care because treatments and technologies are life saving, but only if they are within reach for everyone who needs them. For all the families and beloved ones of the diabetics, your support means the world to us. I'm grateful to my parents for the support they gave me, which has helped me manage myself the way I am today. Your one helping hand can help us a lot. But by that, I don't mean that you offer us sympathy. Rather, we would prefer empathy. And for all my diabetic friends out there, remember comments from people do not define us. We should not let some words or phrases bring us down. It is very important to stay strong because we are much more than our condition. Ultimately, living with diabetes is finding balance in the world full of challenges. And my message to everyone is just simple. Instead of judging, offer kindness. Because even when you can't see the challenges on the outside, they're quite real on the inside. Thank you so much.
Now, we have the honor of inviting Dr. P.G. Mahipala, Secretary, Ministry of Health, Sri Lanka, to deliver
morning to everybody. Dr. Guy Fons, Director, NCD, WHO Representative to Sri Lanka. Dr. Champika Wickramasinghe, Deputy Director General, NCD, Ministry of Health, Government of Sri Lanka. Dr. Savindi Samarakong, Director, NCD. Excellencies, distinguished guests, representatives from the member countries, esteemed colleagues, ladies and gentlemen. It is with a supreme honor, extraordinary privilege, absolute pleasure, and exceptional obligation that I stand before you today to speak a few words on this very significant occasion, the regional commemoration of the unequal access to care and the diseases can only be dismantled through education, innovation, and inclusion. This gathering is a testament to our collective determination to take concrete action. It underscores the critical importance of international collaboration to strengthen diabetes prevention, treatment, and management across the World Health Organization, Southeast Asia region, and beyond. Ladies and gentlemen, globally, already highlighted these statistics, over 422 million people live with diabetes, and every year, 1.5 million lives are lost directly to this disease. In our Southeast Asia region alone, more than 96 million people are battling diabetes, many without access to quality care and treatment. Diabetes is a silent driver of complications, heart attacks, strokes, kidney failure, blindness, and amputations, robbing individuals and their families of quality of life. Sri Lanka faces an alarming diabetes prevalence. The burden of diabetes is acute, the third leading cause of mortality among adults. Our national survey on risk factors for non-communicable diseases revealed that 14.6% of adults aged 18 to 69 have raised fasting blood glucose levels, with nearly half of them undiagnosed and untreated. It is an alarming situation. The recent findings from the Sri Lanka Health and Aging Survey 2018-19 identify our country as a new global diabetes hotspots with prevalent rates higher than the global and regional averages. Even
and
individuals
wisdom
that
how to
weight
overcome this.
are showing
Distinguished
significant
ladies and
glycemia,
gents,
a trend
underscore
warranting
the urgent need to
deeper investment.
intensify our prevention, early
And I'm
detection,
sure
and
the
effective
experts who are present here today and wisdom how to overcome this. Distinguished ladies and gentlemen, these findings underscore the urgent need to intensify our efforts in prevention and effective management of diabetes. The economic and social cost of diabetes and its complications, including blindness, kidney failure, heart attacks, strokes, and amputations, demand unified response, not just nationally, but across the region and globally as well. Ladies and gentlemen, I am proud to say that Sri Lanka, along with other nations in our region, has embraced launch of Global Diabetic Compact, KIASK, by integrating diabetic prevention and management into primary health care and universal health coverage. We aim to address the diabetes burden from the life course perspective. We are also leveraging the Share Heart initiative, which aims, already very well alluded by the regional director, aims to place 100 million individuals with diabetes and hypertension on protocol-based care by 2025, only 1 year to go. This event is a testament to our region's commitment to turning these challenges into opportunities. By uniting experts, policymakers, and practitioners, we aim to align our strategies with the key aspects of the Global Diabetic Compact and formulate the Colombo Call to Action, a roadmap that will guide our collective efforts to combat diabetes in our region. Benjamin Franklin, one of the American presidents, stated, "An ounce of prevention is worth a pound of cure," which is true for all the times. Ladies and gentlemen, over the next 2 days, we will affirm and reaffirm our commitments to the key ask of GDC and collaboratively explore solutions to strengthen diabetes prevention and control. Our objectives are to facilitate cross-learning by sharing best practices from across the region and beyond, to engage a diverse coalition of stakeholders, including policymakers, health professionals, and people with diabetes. We had a good example. To identify synergies and opportunities for collaboration to address gaps in access to care and education, and government require all of the approvals of academic institutions, non-governmental organizations, professional bodies, and international partners play critical roles on this. Most importantly, we must center the voices and the experiences of people living with diabetes as we shape our policies and programs. At the heart of this event is the development of the Colombo Call to Action, as already mentioned. Will reflect our shared vision and priorities for addressing diabetes in the WHO Southeast Asia region. It will emphasize the need for sustained action, resource mobilization, and integration of diabetes care into universal health coverage framework. And at this moment, Sri Lanka government is on a health sector reforms, which is really based on primary health care reforms to deliver integrated care, and NCD care and screening is part of. By uniting around the common agenda, we can transform the regional response to diabetes, and in doing so, contribute to the global effort to achieve the targets of by 2030. Ladies and gentlemen, as we reflect on this challenge, let us remember that we have the tools, knowledge, and partnerships needed to create meaningful change. By working together, we can break our barriers of inequity, bridge gaps in access and awareness, and create a future where every individual with diabetes can live a full and healthy life. In closing, I extend my heartfelt gratitude to the World Health Organization, the Sri Lankan office, and Geneva for their leadership in this great event. And I particularly thank to Guy Fons for his presence here today and Dr. Alaka Singh for the great effort. I also thank the distinguished delegates and experts who have traveled from across the globe, sharing their experience and wisdom to contribute to this critical dialogue. I really thank Dr. Champika for the leadership. First, your expertise, insights, and commitment are invaluable as we chart the path forward. Let us seize this moment to unite as a region and reaffirm our commitment to a healthier, more equitable future for all. Together, we can break barriers. Together, we can bridge gaps. Let us remember that diabetes is not just a medical condition, it's a social challenge. It requires us to break barriers of inequity, ignorance, and inaction while building bridges of understanding, access, and collaboration. Ladies and gentlemen, as we engage in these discussions and debates over the next 2 days, let us keep in mind the lives of millions who stand to benefit from our work together. We have the power to shape the future where no one is left behind in the fight against diabetes. As Nelson Mandela, one of the iconic leaders from Africa, said, it always seems impossible until it is done. Let us prove through our collective resolve and action that diabetes is a challenge we can overcome together. I wish you a fruitful deliberation and encourage all participants to engage actively in the technical sessions, debates, and discussions. May this conference mark a turning point in our fight against diabetes. I look forward to the outcome of this historic gathering. By breaking barriers and bridging gaps, together we will build a healthier tomorrow. On a lighter vein, I wish you a great and a pleasant stay in Sri Lanka with experiencing the scenic beauty in the country and the sand beaches. I wish you all the very best. I thank you.
Thank you, sir. At the 76th WHO Southeast Asia Regional Committee in 2023, the countries committed to the Sea Hearts initiative to accelerate the prevention and control of cardiovascular diseases, committing to 4 ambitious yet achievable milestones. One of the milestones is to place 100 million people with diabetes and hypertension on protocol-based management by 2025. This regional event will mark the launch of a digital Sea Hearts monitoring platform, which will serve as the central dashboard for periodic updating of the progress of Sea Hearts milestone indicators. With this important information, we have now reached the end of this brief inauguration session of the regional commemoration of World Diabetes Day 2024. I call upon Dr. Samidhi Amarakon, Director, Non-Communicable Diseases and Deputy Director General, Education, Training and Research of Ministry of Health Sri Lanka to deliver the vote of thanks.
Thank you. Secretary Health, Dr. Palita Mahipala, Dr. Guy Fons, Director Non-Communicable Diseases, WHO Headquarters, Dr. Alaka Singh, WHO Sri Lanka, Dr. Champika Vikramasinghe, Deputy Director General, Non-Communicable Diseases, all distinguished delegates, guests, and participants. On behalf of the organizers, the World Health Organization and the Ministry of Health Sri Lanka, I take immense pride in expressing our heartfelt gratitude to all of you for gracing this important occasion, commemorating World Diabetes Day 2024 at the regional level. First and foremost, I extend my gratitude to the Secretary Health, Dr. Palita Mahipala, for his inspiring words and unwavering commitment to advancing health priorities, particularly in tackling non-communicable diseases like diabetes. Your leadership will inspire us to work towards a healthier Sri Lanka and the region. And I thank for the messages conveyed by Dr. Tedros Ghebreyesus, Director General of WHO, and a special thank for the Saima Vasad, who is the WHO Regional Director of Southeast Asia, for giving their kind words and blessings for our event today. And Dr. Guy Fons, Director of Communicable Diseases at WHO Headquarters, your expertise and initiatives have illuminated the path for addressing diabetes prevention and management globally. Thank you for your invaluable contributions to this event and to the global fight against diabetes. So this event has, Dr. Alaka Singh and Dr. Champika Vikramasinghe for the leadership taken to plan this event and to make it a real success. This event has been made possible through the collaborative efforts of countless individuals and teams. To the Ministry of Health of Sri Lanka and WHO regional and country officers, thank you for your meticulous planning and commitment to ensuring the success of this commemoration. And to our delegates and participants from across the region, your active engagement and shared experience provide the foundation for impactful collaboration and meaningful action. Thank you for your time, energy, and dedication. Finally, to our technical teams, event coordinators, and support staff, we are in debt to you for your tireless efforts in organizing this event seamlessly. Your hard work behind the scene ensures the success of every aspect of this occasion. As we conclude the inaugural session and look ahead to the discussions, presentations, and collaborations planned over the next 2 days, let us reaffirm our collective resolve to address diabetes through innovation, partnership, and perseverance. Together and create a healthier future for all of us. Thank you, and I wish you all a productive and inspiring continuation of this event. Thank you.
Thank you very much, Madam. And that brings us to the end of the inauguration ceremony, and we would like to invite you all for a group photo by the poolside. Following the photograph, we will proceed to a coffee break and the e-post interactive walkthrough. As you can see, the e-posters are displayed at the back of this hall, and we respectfully invite all the country delegates presenting the posters to be near the posters to facilitate interactions to explain the content. Also, all the participants to make use of this valuable opportunity of cross-learning to get an insight of the good practices by countries on the prevention and management of diabetes. We have time till 10:45 a.m., after which we will proceed with the first technical session on key priorities of the Global Diabetes Compact. Once again, I thank each one of you for your esteemed presence at this event. Thank you.